Professor Meyts, thank you for sitting down with me. First of all, congratulations.
Thank you so much. It's truly an honor to receive this award from you and from PPTA. I feel truly humbled to receive it because honestly, I realize that I'm only stepping in the footsteps of giants, peers and pioneers in the field and making a little contribution to the field of primary immunodeficiency.
I think there are some that would argue it's a larger contribution to primary immune deficiency research and treatment. We were speaking earlier, the field has advanced tremendously.
Well, absolutely. And of course, my career is still rather short, but even in those 18 years that I've been working in the field, I've seen a gradual move, first of all, treating more patients sooner in life, not awaiting complications. I've also seen a tremendous evolution in the way we are treating patients with stem cell transplantation earlier on, less toxic conditioning regimens, and not to forget the more, let's say, targeted therapies that we can offer them for specific conditions. I must say, though, that even if our diagnostic tools and our immunological technologies have extremely advanced, we are still lagging behind a little bit on the treatments. And so therefore, immunoglobulin treatments, which was actually the cornerstone already in the 1950s for the ever first described patients with XLA, is still the cornerstone of the treatment of our patients today. So that's why I feel tremendously honored to be able to receive this award.
How did you get interested in this field?
So that's, let's say, a tricky question in a way, because I was totally outside the field of medicine and healthcare in my family. So I came from a totally different background. But I have to say that thanks to a biology teacher at school who had a Ph.D. in chemistry, I became puzzled with the immune system, with immunology in mammals. And I actually took a subscription on a fantastic journal, which was called Nature and Technique, which was only in the Netherlands and in Belgium. And I got interested in HIV, in secondary immunodeficiency, and so on and so on. So almost naturally, I went into med school to learn more about immunology, about medicine, genetics, etc. And so then thanks to my mentor, Chris de Boek, who's a pediatric pulmonologist, she said, you know, Isabelle, if you're that interested in immunology, why don't you just start a unit that is really targeted on immune deficiencies? And that's the only thing I had to hear. And this is why I took the chance, let's say, to have a PhD in immunology and start in this field.
I can only imagine the patients and families that you've met. Is there any one story that stands out in your mind? Or can you also share some of the transformation you see, especially in pediatrics? I know some of the stories and the photos I've seen are nothing short of amazing.
Of course, any interaction with a patient and a family is special and is mostly gratifying. But indeed, we all have, as physicians, stories of patients and families that are really in our heart. And to name a few, I would think of a boy who had agamma-globulinemia, who was treated well on subcutaneous immunoglobulins, and then all of a sudden deteriorated without a good, let's say, cause that we could find. We were limited in our diagnostics, and at that point, I really made it my odyssey to find what was going on, and we detected a novel, let's say, a virus that was not described before in these sets of patients. And this gave an explanation to the patient. It was long after the presentation, but the struggle this family went through was just, absolutely horrible. But still, I was admiring the courage they had, the strength as a family, and how they even had the strength to be there for others and for other patients. And that is a story I see recurrently in the patients with primary immunodeficiencies and their families, that they, despite the challenges, they have this extreme courage to be there for others. For instance, to create a charity with me for patients with primary immunodeficiency. One family even built a home where patients or parents could stay when their child was hospitalized in our university hospital. So it's absolutely, truly amazing. But to be honest, yeah, of course, it's always gratifying if you have a diagnostic odyssey. You find the diagnosis of the patients thanks to really cutting through the problems and to be able to either cure them or at least save their lives. Of course, sometimes that even is not possible. I must say it's very gratifying and very humbling to be in contact with patients with primary immunodeficiency and follow them in their route to adulthood, or to also, let's say, accompany the families who have the bad luck and the misfortune of losing a child. So in that way, this is a very special niche area where you have all sorts of families and all sorts of stories that are being, developed in front of your eyes as a pediatrician.
Let's switch gears a little bit. Do you consider yourself a role model for other women in STEM? And tell me a little bit more about that.
So, to be honest, I never considered myself a role model, but I've been told recently by many that I am their role model. I think it's important, especially for women, especially for girls. And why is that? Because we don't have naturally, most of us, that typical I speak up gene. I have cultivated that myself. I needed to do that because otherwise you stay in the background. And I think what I've done is only follow my passion, my interest, maybe in a very, let's say, stubborn way, convinced way, that I wanted to do and grow this field in our university hospital. And maybe that's why I'm a role model, because I was basically unstoppable to do that. I think for what I want to do also for my PhD students and for the assistants I have in the clinic is really to give them the opportunity to present abroad, to tell their stories and tell them, speak up, follow this course and talk to this or that scientist, even if they look so much smarter, bigger and older than you. It doesn't matter, just go there and just be yourself and say what you think you have to say. And I think it's good for girls and women to see that.
In your opinion, how can clinicians, healthcare providers, and researchers be better patient advocates?
In a way, we have to think as a central team that we need patient-centered care and patient-centered research in healthcare, of course, in medicine. And in a way, it should not be our expectations of treatment and research, it should be the expectation of the parents and of the patients. So we need to take their role, their minds, and their feelings about the outcome of a treatment in perspective. Maybe we are happy because the lab results are fine, but they still feel bad, they still feel tired. So that's one way of looking at it, really putting the patient in the center of what we are looking for. In a way, I'm trying to do that in my research because we start from the patient, a clinical question, and take it to the lab and try to answer it. The other way I see that we can do better is, in fact, if we go hand in hand to government officials, we can show them that there is still a problem, that this is a population of patients that needs to be heard and seen, and that needs better, let's say, surroundings of care. Not only a medical doctor, but an entire multidisciplinary care team. And in a way, only by doing this together, we can be heard. And in that way, we actually got neonatal screening back on the agenda. And that's thanks to the patients and, let's say, the joint forces with the medical doctors to really say, this is the scientific part, this is the patient part. If you put these together, screening becomes natural. So in a way, that's how we can do better.
And why is it important for industry to partner with academia to further scientific and medical advances?
Well, I've always seen companies or industry as, for me, an example of efficient organization. Maybe that's not always true, but I see that a lot is possible within the framework of a company. The way business is developed, especially the research and development areas of the healthcare industries, are truly amazing. I'm sometimes really, triggered by the esprit of entrepreneurship that is present in companies. Whereas, of course, in academia, if you have the chance of being able to develop your research the way you want it on the topic you want, is maybe also gratifying because the two can be sort of, complementary. So that's why I think ideas that come from academic background translational medicine even, or translational research, they can actually be picked up in a company and be pushed forward in a much more efficient way than we are usually capable of from our small academic background. On the other hand, I also think that it's just a very fertile ground to be in if you bring together industry, patients also, and let's say the researchers or the medical doctors, and together you can actually create a momentum that is very strong to launch new molecules or new ideas. So I think there needs to be more interaction. Maybe there is a lot of interaction already, but I think it can still be on a more structural basis.
Is there anything else that you would like to add that we haven't covered?
So I want to come back to gratitude, because I'm really grateful for this nomination, for this prize, this award. And I want to thank you as the CEO of PPTA. And I want to thank you for your continued dedication to safe plasma delivery to patients worldwide. And I also want to thank in the same way my colleagues in the hospital worldwide, the community of PID physicians, and the members of my lab team and the clinical team who take care of the patients with me. And I also want to say that the future is absolutely in this field. We are going to see continuous increases in patients that will develop immunodeficiency, that will need plasma therapies. And I think innovation is the way to go, and it's fantastic to be able to see that happening.
Thank you.
Thank you.